Hello, everyone. This is Carmen Simons with MDPen MicroNeedling. We're back for another one of our great slide presentations with our excellent educator, Nadine Soni, who's going to be talking with us today a little bit about microneedling the scalp for different kinds of hair loss. I'm going to let Nadine tell you a little bit about herself. Nadine?
So this is my 13th year as an esthetician, and I've been with MDPen for several years now. And the reason why I picked this topic is it was exciting to me because it was one when I first started microneedling that I was a little bit more unfamiliar with. I was used to working on the body and the face. Mm-hmm. And so the scalp seemed like a little bit scary, something I haven't done before. But as I learned about it and realized that there are so many people that suffer from hair loss, it became interesting to me, and it was something that there was a market for, and I wanted to learn as much as possible.
I agree. I think it's an area that we don't think enough about, and it affects men and women. And it's something people would really like to have a solution for because it's such a visible issue. And so we're really excited to have something to offer. So why would we microneedle on the scalp? We've talked about why needling skin on the body, other areas. How is it any different for the scalp?
It's very similar. The microneedling will help generate the collagen and the elastin. It also helps with the body's natural healing process, sending the blood and growth factors to the area that we're working on. With the scalp, it might just be different sections, or it could be the whole head. Just stimulating the scalp and getting that new hair growth to come in, because when we're talking about loss of hair, we're actually not talking about working on the hair as much as the good, healthy scalp to produce that hair. And then also we're creating microchannels. So when we're using PRP and human growth factors and our skin line and our hairline, our shampoos and our mist, it's going to absorb that product a lot better with those channels open.
That's right. I'm glad you said that about starting with a good, healthy scalp, because I think we're going to talk a little bit more about that, and particularly when we talk about the products to use at home at the end.
So I feel like this is the most common one. When we think of someone, we think, oh, baldness. What do you picture in your head? You're going to think of a bald man. So we'll go through all the different categories, but I thought this would be a great one to start off with. With men, their growth pattern when losing hair is going to be on the top and the front of their head. And typically with men, this is happening when they're 50 years old. So the hormone levels change, and that's when you're going to start seeing that hair loss. So this is just an image of a man that's lost some hair, and I think this is probably something that we could envision on our own because it's probably the most common one. So I'll show you. Oh, go ahead.
I was going to say, and certainly we know that this can happen in men much younger too, and the sooner you begin to notice this kind of bald pattern would be the time, wouldn't you think, to go ahead and start thinking about things you can do to treat it rather than
And I'm glad you said that, because I feel like with most things, if you think about it across the board, when you've got a problem, the sooner you get to it, the better. Even if you're losing a little bit of thickness, I mean, if you want to, you can't do it too early. You know, if you want thick, healthy hair, this is a great treatment for that too. Even on a cosmetic level. Right. But I think on average 50, but you definitely see it with people that are younger. It just depends on like if it's hereditary or not, that they would they would lose that hair.
That's a great point about thickness, because we talk about hair loss, to baldness, but there's also just general thinning that you'd like to do something about sometimes, just to have more a body and more thickness to your hair. So let's move on and talk a little bit about.
So with women, this is something. Of course, we've got it. We care about it even more, and yet we get hit with it worse, I feel like, So with women, we're going to start losing our density at 30 to 40 years old. That means we're going to get the thinner hair. We're going to notice it, but we kind of try to work things out with products, flipping our hair, and we're going to kind of put it under the rug, not
cutting layers,
and trying to be in a little bit of denial. This is a nice thing that can give us an option of making our hair less thin and and just having a fuller scalp. But by the time a woman is like 50 or 60 and then they're going in menopause, that's when we're going to notice deeper levels of hair loss. And that would be more when we would feel probably that it's a problem. And so for women, I think we could, you know, start, like I said, 30 to 40 with losing the density, but 50 to 60, depending on when your menopause is, that's when you're going to lose your hair. Now with women, our thinness starts more on our part, where our part is. Mm-hmm. And then what happens is over time the part just gets wider and wider and wider. So, you know, we go from having like a small, you know, combed part to like we've got a split in the middle of our head. So with this, that would be the area that we would concentrate on, is just, you know, the widening of the part on the top of the scalp. Okay. Our next hair loss is alopecia. This is when we have a lot of stress in our lives, maybe more than the average, more severe stress, and when the immune system attacks the hair follicles. So this is not a permanent hair loss, which is a great thing. That's good. And hopefully the stress isn't permanent either, you know, but this is not a permanent hair loss. This can definitely be reversed. Alopecia normally comes in like patches. So we're just going to see a circle of bald patches on the head. And this is something that, and I don't know if I've mentioned it in the prior slides, but you can just work on that area. You don't have to be microneedling the whole scalp. Right. If their area is just, you know, a patch in the front and you know that it's not going to start going anywhere else, it's just kind of, you know, this is the area I'm losing some hair because I've got some stress going on in my life. And this is just stimulating that, the scalp, putting it back into action and fighting against that and getting that hair to grow back. Okay. With our next hair loss, this is called the telogen effluvium, and this is from people that have had surgery, childbirth, an illness. This is where it just kind of just falls out. It is reversible. It's not permanent. Again, this is something that's common in all ages. Mm-hmm. So when we were talking earlier, you're thinking, you know, someone goes bald, you think, you know, old age maybe. When looking into the hair loss, it's quite interesting to think, you know, you think maybe someone has, let's say, for example, someone has a child at 23 and here they are losing hair. Mm-hmm. So this is something that can be reversed, and you would just work in the problem area. This is probably going to be a little bit more consistent throughout, but work on the areas that you see where the problem is, and again, it's not permanent, so that's nice.
That is good news. And certainly I know I've seen lots of women with loss very similar to what we see in the picture after childbirth, that's sort of near the temple, just along the hairline. So it's good to know there's something you could do about it.
And what I like is, and we'll talk a little bit later, is when you're doing this microneedling and you're combining it with home treatment products, mm-hmm. that's when you're really going to give that nourishment and that boost. But we'll get into that a little bit later. Okay. And then lastly, we have the anagen effluent category. This would be the people that are on cancer treatment drugs, people that have certain exposure to toxic chemicals and like fungal infections. This would be something that I would want to refer to a physician. I think that would be the best for the integrity of this type of hair loss. Okay. So getting into how to treat the scalp. People use their hairsprays, they've got all their magic stuff. Again, it's just like hair. They tell you they've got nothing on their scalp, and they do. So we want to make sure that we're cleansing the area first. If we're only working, you know, for like example with this man, we're working in just the middle of his scalp, no need to cleanse all the sides. Concentrate on the area that you're going to be working on, and then get some before pictures. It's important with the scalp to definitely numb. This would not be something that we'd be doing with the refined needle. This would be a restore needle treatment, and with restore needles, we're always going to do the numbing. So you want to make sure that you're getting that on across the area in which you're working. You can see with our patient here, we're not working on her whole scalp, just kind of the area where she's got the hair loss. So if the client has hair, we want to move that out the way. We're not trying to numb their hair. We're trying to get their scalp numb. So we want to part their hair, apply the numbing cream to the scalp. And actually, while we're on this slide, I wanted to say, I think it's good to let the client know in advance kind of the nature of how we're going to go about this, so they know your job is to make sure that they're getting a nice result, and that you're doing the treatment. You can see the area you're working on, so let them be prepared to know that maybe they want to go home and wash their hair after, or maybe they want to shower, or maybe the hair look a little messy, because what you're not trying to do is be neat. You're trying to do a great service on them. So
that's a good point.
Yeah. Okay, so after you've numbed for 30 minutes, you want to make sure that you're cleaning the area. So here we're doing it on the face, but it's the same protocol that would be on the face, on the scalp. You're going to clean the area, get rid of the numbing cream, but then you want to make sure, sometimes there can be residue from that. So you want to make sure that you use an alcohol or witch hazel afterwards. With the face, I always kind of gravitate towards the witch hazel, because I think we're not breathing in the alcohol. It's a little less sensitive. I think with the scalp, I think the alcohol is a little bit stronger. It's not going to make a difference on their scalp in terms of comfort. And then you can rinse with a distilled water. Okay. So after we've got everything ready, we're going to pull out of our pen. We want to make sure that we adjust the speed and depth. First, make sure that you're calibrating your pen, having it on a high speed and not have a setting of 0. And we'll go into the treatment settings once we get to that slide. So during the treatment, we're going to use the MDPen Serums. You can do the PRP. That's always the perfect go-to. We'll never tell you not to use the PRP.
Yes.
So that's what we're going to be using during the treatment. Now, for the slide on the treatments on the scalp, I think that the hyaluronic acid, it just gives a really silky smooth slide. So what I like to do is when I'm using the pen on the scalp, use that hyaluronic acid, and then after you've opened those microchannels, then put that PRP into the scalp, opposed to doing the PRP. It wouldn't do any harm, but I think to get full advantage of the whole treatment, get that nice slide with the hyaluronic, open the channel, and then infuse your scalp with that the PRP.
Right, and certainly the PRP is very precious, and you don't really want to use it just as a glide. You want to make sure you're applying it once those channels
in a very concentrated area.
Right.
Yeah.
And it interacts really well with the hyaluronic.
All right, so the first thing, like I was saying earlier, you're going to use the hyaluronic. That would be your first step onto the scalp with your treatment. Okay. With the hyaluronic, I've mentioned this before, it's great to have in a cup. You're not going back and forth, contaminating your container, and then you can double dip. It gives you a little bit of freedom in your service, which I think is wonderful.
Yeah, I think it's a great protocol, and we always mention it when we're just going through the steps of how to get ready to do your treatment, so that you can get out your product and not have to be touching your bottles once you start.
So here we're just going to apply a real thin layer. And when you apply this thin layer of hyaluronic, you can see the doctor here is massaging into the scalp, getting that blood flow going, and so we can start working on those dead skin cells.
Right, get those all disrupted there. So with working on the scalp, we can do two things. We can trace or we can stamp. So when we trace this, it would go 1 inch per second. So you just go really slowly with the tracing, and you would do your 3 passes. And when you're doing the stamping, you just hold onto the scalp and then release up. After a second, you can lift up. And you can, like I said, do this three times. So we'll go into when we would choose which one. Oh, great. And we'll see that the method too on the following slides.
Right.
So if you're tracing.
So here we're tracing. When someone doesn't have a lot of hair, you've got an open area. It's no different, kind of like the rest of your body.
Right.
You don't have hair on it. You can see exactly what you're working on. There's no reason why you wouldn't want to just go ahead and do the tracing. So here we're just doing, we're keeping it 1 inch per second. The depth would be 1 to 3 millimeters. That would be on your pen depth. So again, when using this service on the scalp, no pressure needed. You're controlling your treatment with your settings. So the settings are always going to be 1 to 3. The way we would decide how deep we'd go is along the hairline, we've got quite a lot of sensitivity. So I would recommend doing the setting at 1. But when we're going into the thicker part of the scalp, middle of the head, back of the head, then we can go up to 3. Now, if someone's feeling uncomfortable, then we would take it to a lower setting. But that would be our gauge normally in terms of areas on how to apply the settings. And then because it's the scalp, we're going to do medium speed.
Medium speed, okay.
Now with stamping, when someone's got a good amount of hair, just not what their preference is, we know we can get it to a better level, then we're just going to separate the hair and stamp. And so as you can see here, just parting it, holding down for a second, and getting that stimulation going. And again, with the stamping, it's going to be the exact same, 1 to 3 millimeters, medium speed. Remember the hairline, they're going to remind you if you don't remember. The hairline is a lot more sensitive. Start with a 1 for the hairline, the thicker hair. The thicker part of the scalp being the middle and the back, you're going to do it at a 3.
Okay.
So here's a great a picture or video of our PRP. You can apply the PRP during the service as you go, as the microchannels are immediately opened.
Right.
So we're going to do our slide with the hyaluronic, but then immediately you can put the PRP in, rub it in, while those microchannels are nice and open. So you're going to get your best results with the PRP. If you're not doing PRP, you're definitely still going to see results. I would definitely recommend, though, for you to be using like a human growth factor, our mist, and for everyone at home, that our shampoo. So we'll talk about that.
Okay. So
here is your end point. You want to get minimal bleeding. So if ever you see pictures on the internet that look bloody, if that's the blood that we've spread across the head from doing the PRP, that's one thing. If their head is just bleeding, then you're going to aggressive and you need to adjust your settings. Your scalp's going to immediately tell them, tell you what, if you're going too deep.
Right.
So just pinpoint bleeding's fine. You're just trying to stimulate that scalp. You're not trying to attack it. We're not trying to give it an aggressive wound. That's a nice thing about the MDPen specifically, is that we do have different settings. We do have different speeds. So we're not treating our eyes the same as the way we're treating our leg or the way we're treating our scalp. So medium speed, and this would be a picture of our end point. And then when you're done, you're going to use the copper mist. And that's just going to help with any inflammation. The nice thing is, with it being a mist, you can spray it. So it's just, clean and simple. Clean and simple, we like that. And all our treatments, we end with the mist. So that's an easy thing to remember. As I was saying earlier, if you're not going to be doing a PRP, then definitely be doing the human growth factor, whether this is included in your price or whether you add it as an add-on. This is going to get your results a lot quicker. It's going to promote the healing, and the gel is very, very soothing.
It is. So
for someone that's like a little bit sensitive, or a little bit you get clients a little bit on the baby side, this is great. This is a really, really soothing gel.
And it really helps with the redness. We've seen it in demonstrations where within 10 minutes you can really see a decrease in redness, which lets us know that it's really helping bring down that inflammation too.
I keep this in my treatment room when I do the microneedling on the face. It's my go-to. It's my little safe factor. So as long as it's a little too red, it's there, and it does immediately takes it down before they're leaving. So it's my little safe product. Makes me feel good to have in the room. And so for going home with the home care, with the hair treatments, we're going to use the human growth factor. We've talked about that. We've got the hyaluronic for the slip, the mist for the inflammation, and now what we've done is we've created a shampoo specifically for this service. The reason why, and we'll go over probably on one of our future lives upcoming soon, since this is one of our new things that we're bringing. and we'll go into detail about this product, but I have to say the thing that I like about it, it's made and it's customized for people that have weak or damaged hair. And what it's going to do is it's going to help provide them with a healthy scalp. But some of my favorite ingredients in here are the salicylic, which helps with that buildup on your scalp.
Right.
We've heard of salicylic in the skincare industry and its benefits. Well, now we've put this into a shampoo, which is pretty nice. Because of that, there's not a lot a lot needed. Mm-hmm. This is going to be something that you're just going to use a little bit of. It goes a long way, so the product lasts long because it's got some active ingredients like salicylic. The kale, the carrot, the lemon proteins, they're all going to be nutrients for the scalp. It's going to just make you have a overall healthier scalp, and it's going to be stimulating for that new hair growth. This would be something that if you know, I know my mom used to tell me, wash your hair properly, and, I was little, having thick Indian hair. Right. My mom would be like, you're not washing your hair, you're washing your scalp. And same with this, to get the best benefits, you want to massage it into your scalp for 3 minutes, and then rinse it with cool water so you're tightening those pores back up. So just to kind of brush over that, I think it's a great thing for them to complement their service when they're at home, and they can just switch to this as a regular shampoo. This wouldn't be an after treatment for 3 days. This would be something that would be supporting their best hair health.
I love that. I love what you said about the cool water. I think we all tend to make the mistake of wanting the water to be super hot when we're washing our hair. So I think that's a great reminder that trying to make that scalp, those pores constrict. That's a great point.
And I don't know if you've noticed, just in general, with any hair products, with any soaps, anything that we're using on our body, on our face, on our scalp, the cheap stuff, you have to use a lot more of it. And then the stuff that's got the active ingredients, you need a lot less. So here we are, you invest a little bit more money, and it all evens out in the end anyway, because I know if I use some cheap conditioner on my hair, I'm using big blobs of it. If I'm using something quality, I'm going to use a little bit. Well, with this, just like I said, just like a quarter size would be plenty enough.
You're right. It's very, very concentrated.
And then the other thing I wanted to talk about, and this is also new to our line and it's exciting, is the hair protecting mist. So with this is great, again, for the weak or damaged hair. It's great to go with someone that's getting the microneedling. This would be applied on a wet scalp, and you want to massage it in just to the problem area. So no need to put this all over your head, just whatever your problem area may be. Massage this in, and this is going to help strengthen your hair. So just having nice, strong hair,
especially as you're encouraging that new growth hair.
Yeah, because when the new hair comes in, sometimes it's a little bit softer, and over time it gets thicker and thicker. Right. And so we just want to kind of bring all that back to life and just have some nice, strong hair.
Well, thanks again, everybody, for listening with us another week with one of our presentations about incorporating microneedling into your overall skincare practice. If you want to get more information about MDPen or any of our products, you can go to our website and click on the schedule link. MDPen.co is our website, and you can schedule a call, and we'll have one of our product specialists to give you a call and talk to you more about any of the products that you heard about today. And just for listening in and coming to one of our classes, you can be eligible to get $600 off the price of your electric or cordless device if you decide to purchase. You can talk to that specialist on your scheduled call about it, or you can call us direct at 888-313-1415. We'd love to talk to you and hopefully get you started with microneedling in your practice.
And then just lastly, I wanted to say, like, with this being maybe something a little less familiar to people as the body or the face, if there's any questions, definitely leave them in the comments, and we'll come back and answer them if there isn't something that we covered, or if there's something you were unsure about. Now that we've got this new information delivered to you, feel free to write the questions, and we'll get back to you.
Yes, feel free to comment and let us follow up with you here on Facebook. Thanks so much for tuning in. Talk to you next week.